वो करते हैं
Uh,
पैसे।
you can start now.
Hello, hi.
Hello.
Yeah. May I confirm this is Mr. John, 50 years age?
Yes, doctor. Yes.
Okay, I am Dr. Shoaib in this clinic today.
Thank you, doctor.
Nice to meet you, Dr. John, Mr. John. So, do you have any idea or do you have any expectation today, any about this meeting?
Yes, doctor. I'm thinking that I have some diseases in my tummy because I was with my GP and he investigated initially for some
Okay.
infection, but he didn't find anything because I'm suffering
o-
from this yellowness of my eyes. So I came
Okay.
here to collect my reports today.
Okay. Yes, I got a referral from your GP that you have some illness in your eyes. You are feeling fatigue. You are having some weight loss in the past 3 months. Is that correct, right?
Yes, yes, doctor. Yes, you're right.
And after that, we run some your blood tests, some scans of your body. And today we will discuss about the reports and your problem. Is that okay with
Yes,
you?
yes, yes, doctor. Please, I'm waiting, anxiously waiting these results because it's very important for me. Because
Yes.
doctor was telling that I might have a cancer. Yes, I'm much worried about that. Please tell me the reports.
Uh, who told you about this? Okay.
And the GP doctor was thinking about that because he ran
Mhm.
some blood test and he thought that there is it's a more than this infection. So he referred me to the specialist clinic. So he did
Okay.
a scan of my tummy and he was also thinking about that. So I'm here to
Ah,
collect this today.
okay. Okay. So, do you mind if you want to accompany anybody with you in this clinic now?
No, no, doctor, no. It's okay. You can
Or
continue.
are you comfortable that we will discuss this problem with
Yes,
you?
sure,
Yeah.
sure, doctor.
Okay. So, as you know that these problems are running with you in the past 3 months, and you are having some issues regarding your health, and now we have the reports and results of your scans and of your blood test, and but I'm afraid to tell you that the results are not good.
What do you mean, doctor? Not good. What's wrong with me? What happened?
Yes, yes. I will explain it in to you now. So the blood test and the scans of your body, and it tells us that you have suffering from a condition. We call it as a cancer of one of your organs of your body.
Oh
It's
my
called
God.
as
Oh my God, doctor. What you're telling me? I was not expecting that. Oh my God.
yes,
Why?
I
It's,
believe.
are you sure, doctor? It's me.
Yes, we checked
Oh,
your details, your name, your address, and all these things. And after that, we are here in this clinic to reveal this bad news for you today.
oh
I'm so
my God.
sorry to tell.
Oh, doctor. I'm living a healthy life. I'm walking daily. I'm not smoker. Why it's me, doctor? Why?
Yeah, I appreciate your concern. Do you mind if you want to drink some sip of water?
No, doctor. Oh God. Why,
Uh,
doctor? Why this with me?
yeah, I can understand this feeling, and so I'm going to tell you. If is it okay with you that if I draw some drawing with you and I explain in a better position to regarding your tummy and organs, and regarding why you have having this yellowness in the eyes. So I'm drawing here your tummy, and in the side of the tummy there is a pancreas, and there is a tube coming down which pours the secretions, and it is blocked due to this tumor, due to this cancer. That's why you are having this yellowness. Okay, do you know anything about the cancer? What is cancer?
No, doctor, I don't know about any idea. I heard about that there's a serious condition and I may die. Doctor, is it that I'm going to die now? There's no hope?
Yeah, it will be too. I have highly appreciate your concern about your health condition. So it will be too early to decide or too early to tell you. Now, I will run more tests, and I will run more. I will arrange with your appointment with my team, with the cancer specialist doctor, and with the tummy doctor, and then we will be in a better position to answer these questions.
So, doctor, I
And
hope you will treat this cancer. I hope.
yes, I highly appreciate your concern. So in the same thing, I explain you again that this condition you are suffering from, it is we call it as the advanced type of cancer, as the last stage of cancer, because it also affecting your other organs. I'm so sorry to tell
Oh
you.
my God. Also affecting my other organs also now. Oh,
Yes,
doctor, you
not
are breaking
yes.
bad news to me today. Oh my God.
Are you okay, Mr. John?
I'm okay, doctor, but remove it. Please try to remove this cancer from my body if you can, please, because the cancer is very dangerous. I heard about that.
Yes, I can understand your concern about your health. So that's why we arrange already. We discussed our meeting, a team. We discussed in our meeting that regarding your condition, and we saw the scan and involve other specialty doctors, which are very highly experienced doctor in removing the cancer. And all these doctors have come to the conclusion that now it is too late to remove the organs. Unfortunately, I am going to tell you this.
Okay. Oh my God. Oh my God. 2 minutes left, doctor. So what you're going to do with me now?
So we will arrange another
You are
meeting.
you are not going to treat me, so I will die. It means you are letting me
Yes,
die now. There is no
no,
treatment now.
we are here to help you. We are here to our best to help you in this condition. We will not going to leave you alone, believe me. So we will arrange with you another meeting of tummy doctor who will put a stent in your one of the tube of your pancreas, and then it will release the pressure, and your yellowness will go in, hopefully, and this pain will you will relieve, you will feel better. And this is, we call it as a conservative management, and we will arrange another meeting, another appointment with you, with the doctor. And do you have any other concern?
But what do you mean by some procedure? What is this procedure?
Yeah, this is the diagram I was going to explain you. This is your tummy. Was the pressure you are having. This cancer is blocking this tube, and we will put a whole a stent in this tube. It will open, and then you will relieve. It will make you ease, and you will feel better regarding your yellowness.
Okay, doctor. It will be a painful procedure, I think. No, doctor, I don't need this procedure. I don't need this procedure, doctor.
Yes, I highly appreciate your concern. I will explain it again that it will release your symptom. It will alleviate your pain. It will alleviate your yellowness, because now you are yellow in your eyes. So at the same time, it is performed by the highly professional doctors who are expert in this procedure. So be assured that it will be good for you.
Doctor, I need some time to think about that because I'm a bit scary about that to have a procedure now. First, you told me that I have a cancer. Now you're going to open my tummy and you want to do some test. No, doctor. Really, I am afraid today. I
Yes,
want
you
to
can.
take
Yeah,
some
I
time
agree.
to think about that.
Okay. You can take time. You can in the next meeting you can tell me about this decision. Okay. Any other concern do you have?
Doctor, I don't know what to ask. Is there any other thing except this procedure? Other medicine you can give me some
Yes.
which will help me to
Yes,
treat this
for
condition?
sure. For sure. Other than this procedure, this is one part of your treatment. Other is that we will fix the meeting
Time
with
up,
you.
but time up, but you can continue.
Okay. So we will fix the meeting with your cancer specialist doctor and tummy doctor, and the best possible option treatment we have, we will explain you in the next following meeting. And be assured that you are not alone in this disease. We are with you, and we will not leave you alone, and we will help out you throughout. And I will give you some brochures. I will give you some more information leaflets, so it will help you to understand this disease in this stage, and to answer your other questions, hopefully.
Thank you, doctor. Thank you, doctor. Thank you so much. Thank you.
Thank
So, Dr. Shoaib, sorry if I was rude a little bit during
you. No
the
problem. I can.
surrogate. Okay. So,
Yes.
what do you think? How
I
it
don't
was?
know. I no idea. I try my best.
Well then, overall, it was a good effort. Actually, uh, you gave a empathy, but later, in this case, you break a bad news. That was very good, but you to do something more about that, and you gave information about this disease. That was a demand of this scenario actually, and you were dependent on also the concerns. You asked the concerns, the patient. That was very good, and there are few things need to do actually when you're going to approach any
Yeah.
scenario in communication.
Okay. Yes, please.
Uh, Let me explain you. If you are going to attend any communication scenario in PACES exam, there
Okay.
is a few things you need to do when you are preparing this scenario outside the room in the exams. Okay,
Okay.
whenever you have a card, you need to draw some roadmap for you, and when you are entering the room, especially
Yeah.
take the name of the patient first of all. See what's the age of the patient and what is the diagnosis and what is your role, who you are, where you are in the clinic, in the ward, or in OPD.
Mm-hmm.
Okay, and take the important data, what has been done so far with the patient. Okay, this is a universal for all cases, whatever the case you have in exam. So you have to do this, because
Uh-huh.
if you are not familiar the name of the patient, you will suffer some few problems while you are sitting in the room when you are entering the room, because when you are going to introduce yourself, if you
Mm-hmm.
forget the name of the patient, you can ask, can you remind me your name and age, please? Otherwise, if you want a good impact on the surrogates and the examiners,
Mm-hmm.
then you can introduce by yourself in this way. Hello, my name is Dr. Shoaib. I'm one of the doctor today in this clinic or facility. If you don't want to be a confused person in the exam, so don't
Yeah.
mention any clinic. Just mention, hi, I'm a Dr. Shoaib. I'm one of the doctor today in this clinic or in this facility. So it will cover all the stations. Whatever the settings are there, no need to remember that. Okay.
Okay.
So if you know the name of the patient, it will, surrogate, it will a good impression. Am I talking with Mr. John, 50 years old?
Mm.
Okay, then see,
Okay.
the first thing is introduction, lab investigations, then see what is the task given to you. Okay,
Yeah.
There are different categories actually of the communication station. There are few categories. You can have a few categories like breaking bad news, palliative care, DNR, okay, disease explanation, drug explanation, and to deal with the angry patient, medical error, okay. Whatever the scenario, whatever the communication station is, there are fixed format for every communication station. If you follow this format, you definitely pass this exam very easily. No need to open lot of books, no need to go anywhere. Just follow your given format and you will be a successful candidate. How you can do this? You can do this in this way. You take the data of the patient, you know the settings, you know your role, what's your role, who you are. You are a SHO, you are a consultant, you are a GP, who you are,
Yeah. Okay.
and see what's your role and what is the diagnosis. Okay, if your role is to, for this, for example, for this case, you
Mm.
was given a task to discuss with patient who is having cancer, okay, and a palliative care next future plan already given to you. This is a ERCP will be done to relieve his symptoms, right?
Yeah. Right.
So you had two tasks here. First task is to breaking the bad news, and second task is to
To
give the
explain.
procedure information, to explain the procedure.
Yeah.
So you have done a first part beautifully, very
Mm.
easily, okay, but
Yeah.
you were unable to deliver the information about ERCP to the patient. This were
Mm.
also. So why this happened? Because there is no set format. In
Mm.
PACES, you need formats, formats, and formats. It will lead to a successful story of your life. You will be a good candidate. You will be a successful candidate if you are following the formats. In long communication consultations, in communications consultations here, and
Yeah.
also in cases also, because it's an exam of only to speak out. What you are speaking, it doesn't matter. Your accent, what is your accent, doesn't matter. How you are fluent in English, doesn't matter. But you need to speak in English, whatever this accent you have. You need to convey your message to the surrogate, not surrogate, because surrogate having questions only. Where are the answers? Answers are in front of the examiners. They are having marking sheets, they are marking. Ignore surrogate, whatever he is asking, but actively listening is an important part. So
Yeah.
first thing, sitting outside, you see your patient's name, data given, what investigation has been done, just write down. Okay. Why? Surrogate can instigate, can ask if he has had a endoscopy done. For example, he can ask you, doctor, why you are not going to do endoscopy for me? If you
Mm.
know the knowledge, then he has already done this endoscopy. You can ask, you have already, we have already done endoscopy. The results are fine. Okay. No need to, he can check your, how you are mentally present there.
Mm. Okay.
First thing done. Second thing, introduction. You are going to inside. Hello, my name is Dr. Shoaib. I'm another doctor today in this class. Am I talking with the Mr. John? Very nice. Then set an agenda. We are here to discuss with you about your health condition. Is that okay with you? Yes, doctor. Done
Okay.
first part. Come to the second part, background knowledge. This is a set point for any communication station. Again, I'm going to repeat you.
Mm.
To make thousand of formats, make a universal format, whatever the disease, bring it that disease, put in this format, process. There are few technical points, communication concerns which you have to answer at the
Mm.
moment. Otherwise, you will successfully, you can get easily 13, 14, or 15 marks in every station of communication. Second
Okay.
thing is background knowledge. To be on
Yeah.
the same, can you tell me, Mr. John, what do you know so far about the health condition? He will give you the story.
Mm.
Doctor, I had a jaundice, I had a tummy pain, I was suffering with that. I went to GP. GP did some blood tests, but he didn't find anything. He referred me to the hospital. I came, I admitted here, and the doctor started making a scan, some tummy scan, because they were thinking there may be something more serious than that. They were
Hmm.
talking about cancer. Okay. I highly appreciate your knowledge about your condition, Mr. John. You have to appreciate him.
Hmm.
Third thing, come to the eyes. What's your expectation from today's meeting? And what do you think? What might be the results of that scan, Mr. John?
Hmm.
He will give you the answer. Doctor, I don't know. I don't think so. That might be something serious or like that. Because already he has some idea. These
Hmm.
are
Yeah.
the fixed paragraphs you can use at any station. No need to search new paragraphs. Why? Because you will forget new words in examination. Set your fix words in every station, any communication, so it will be a fluently you can deliver to your surrogate. Fourth,
Okay.
okay, Mr. John, we have received your investigations and labs and scans. Okay, I'm very sorry to tell you that the results are not as we hope, and take a pause. Okay,
Yeah.
take a pause. Let him absorb this information. What do you mean, doctor? What is the test results reveals that you have a cancer? I'm very sorry to tell you that you have a cancer, and moreover, it's spread to the other part of the body also. It is involving now liver and other parts. Break the bad news not in a chunks. Give him immediately. Let him
Hmm.
drain out. Okay.
Okay.
Whenever you
Yeah.
are going to give the breaking bad news, give him sympathy and empathy. Patient
Okay.
is silent. You must be silent after 30 seconds or 1 minute. Yes, Mr. John, I can see you are very upset today. It must be a difficult time for you. Okay, this is it's very hard to have a such bad news, but don't worry about that. We are here to help you and support you. We have a very professional team of doctors. Okay, so
Hmm.
give him empathy and empathy. He will speak with you. So, doctor, what you are going to do now? Whatever the case, whatever the scenario, after breaking bad news, come to the escape. You can use the mnemonic escape here.
Yeah.
Okay, ESCAP. Escape. Actually, etiology. E for etiology. Give the etiology of any condition. For example, this is a cancer which is causing obstruction and the sign and symptoms. Actually, this cancer is the one part of your gland, so it's causing the compression on that area. There's a tube which is a blocked now, so you the bile of
Hmm.
the of that has been obstructed, so you are feeling the tiredness, symptoms, jaundice, and fatigue and tummy pain. Okay, sign and symptoms, organ complication. If we are not treat them at the moment, it can go to a serious condition also. Give him a bullet shot here. Why? It's very important. If you are not going to give him complication, he will not agree with you on any point to go with the procedure.
Yeah. Okay.
Okay, give him a very severe complication, but stepwise. If we will not treat this patient, if the condition, it might go to a severe complication. Okay, that you may die in the future also.
Okay.
Then A for action. Tell him what we are going to do now. We have a team of doctor. We have discussed. Okay, so surgery is not possible because the disease has already been advanced. So there is a palliative care. Sorry for the medical terminology. Palliative care. What is palliative care? Mr. John, palliative care is a treatment of supportive management. We are treating the patient's symptoms, not actual disease. We give
Hmm.
some idea and come to the ERCP. So our team has decided to relieve your symptom with the help of this procedure known as ERCP. Sorry for the medical terminology. This is a procedure which can be done in this way. Let me draw for you. This is the actual time. This is the appropriate time for the drawing.
Okay.
Draw a lever, bring a tube down, draw a pancreas, connect all these together with the gut. Tell him this is a liver, this is your pipe, which is bringing the secretion of the liver. This is our pancreas. Sorry for the medical terminology. This is a gland which is help in digestion, and this is our gut. All these very important structure in our digestive system. Once these got obstructed, you are feeling the symptoms. So what we are going to do, we have a flexible tube, a camera at the end on that. Okay, with the help of this camera, we are passing this tube through your food pipe, stomach, then to the gut, and we will open this obstruction with the help of small tiny plastic stent. Don't use stent. Stent is a jargon. Okay, a piece of tube which will open this passage and your symptom will be relieved. Do you have any concern, Mr. John? Doctor, this procedure might be painful. For this reason, let me explain for you. Whatever the procedure, you have a very superior mnemonic in your mind, PDA. Pre,
No.
during, and after. For this, we have an expert team of doctors. We are usually giving a medicine which will numb your throat. You will not feel this pain or any complications. During procedure, we will put this procedure, we will pass through this tube and we will open it. This during. After procedure, you will be kept under observation. That might be some complication which are very rare, but there is a possibility. What kind of complication? Infection, aspiration, decrease oxygen. It's our hospital protocol. We are keeping him. Any patient here, so we will observe you. Don't worry about that. We have a professional team of doctors, nurses. They will take care of you. Don't worry about that. Whenever you are
Yeah.
explaining any procedure, at the end of the procedure, you give him some complication also. Of course, like other any procedure, there is a few complications. What are the few complications? BIT. 3 complication in any procedure. Use this mnemonic and save your time and ease your life. Bleeding, B for bleeding, I for infection, T for trauma. Whatever the procedure you are going to explain, just give 3x these complications and save your time. Of course, there are few complications, but we have expert team of doctors. The very rare chances if there is develop any complication, and we will deal accordingly. Okay.
Yeah, got it.
Okay, got it. So after escape, there are double C. You are going to know at the end. There is a last part of this approach. Concerns. Do you have any concern, Mr. John? Doctor, no. Before this, sorry. Before this, after explanation of the procedure, now raise the agenda of consent form. Legal issues. You will bring the legal issues in your discussion. Examiner is listening you. So for this procedure, for this protocol, we have a consent form. We need your agreement. I will give you the consent form. You will read it. All information I gave it to you today, all written there. You take time, discuss with your family members, and don't worry about that. If you sign this consent form, after that you can take it back anytime. Don't worry about that.
Okay.
Information is once your consent form will be filled, assigned, then we will discuss our team and we will go with for this procedure. How that sounds to you, Mr. John? Okay, doctor, give me consent form. I will discuss with my family member. Give me some time. Yes, of course. Take your time. If you need any help, then I can involve my senior also. We can sit together and we will discuss again. If you have any queries, any question. Do you have any concern, Mr. John? No, doctor. Okay, thank you for your time. I'm going to share with you some websites, videos, brochures, leaflet about this procedure. Which procedure? ERCP, for your better understanding. If you have any queries or question, we are here to help you and support you anytime. In this way, you can manage your time, 10 minutes, and you can finish your task easily.
Okay.
You have any question now?
Yes. One thing is like the surrogate asking why I am having this cancer. How we will respond this?
I highly appreciate your concern, Mr. John. Okay, I highly appreciate your concern. It is very difficult for me to answer this question because I don't know the exact reason behind that, but that might be from your genetic makeup. Okay. Environmental factor, there are a lot of factors behind that. It's very early to say about that. But it
Mhm.
happened. Now we need to think about what we are going to do next. How can we help you in this regard?
Mhm.
You can answer this concern in this way.
Okay.
Whatever concern you are facing, if you don't have answer, just say sorry. I cannot answer you at the moment, but I can discuss with you with my seniors and I'll get back to you very soon. Very easy escape. Any communication station, whenever you don't know the answer, just escape, search a way to quit that question. Come to the
Uh,
next question.
Sorry, I cannot. Again, please.
Sorry.
Yeah. How to escape this line? How to tell?
If you don't have any answer, tell him honestly. Sorry, Mr. John, I cannot tell you the exact cause, exact reason behind that, but I will give you answer. Okay, after this session, after this consultation, before you leaving this place, I will get back to you. I will discuss with my seniors.
Okay.
No need to give false information because surrogate know about that. Surrogate examiner watching at you, they knows very well everything because answer they have on the marking sheet. If you will tell him honestly, they will trust you and they will not deduct your mark. Otherwise, if you give fake false information, so you are in trouble. Don't make your life difficult in examination.
Yeah.
Any question about that?
Yeah.
Anyone
Okay.
want any question? So if no question, then we can end this meeting. And thank you for joining today. And we will get back very soon with the long clinical consultation. If there is any doubt, anything regarding this format, how to approach a communication station, you can ask. We are here to discuss with this regard.
Thank you, Doctor. Thank you so much.
Thank you so much for everyone. We will see you inshallah soon.
Thank you, doctor.
Welcome.